Hello, everyone. Today, we're going to talk about something that comes up pretty often on liver scans, but can be a source of a lot of confusion and worry. We're going to walk you through what focal nodular hyperplasia is, how we diagnose it, and most importantly, what it means for your health. So, let's start right here. You've had an ultrasound or a CT scan, and maybe a completely different reason, and your doctor tells you that they found a spot on your liver. Hearing that can be incredibly stressful, and that uncertainty can cause a lot of anxiety. The first thing I want you to know that you're absolutely not alone. We call these incidental findings, and they're very, very common. And the good news is the vast majority of them are benign. That means they are not cancerous and they're not a threat to your health. Okay, so this brings us to the first big question I'm often asked. What exactly is this thing they found, this focal nodular hyperplasia, or FNH for short? Let's break it down. The medical definition sounds a bit complicated, but here's what it really means. FNH is a non cancerous growth made of perfectly normal liver cells or hepatocytes. They're just organized differently. In fact, it is the second most common benign solid spot we often find in the liver. So it's something we see quite often, and let's boil this down even further. What does this mean for you? Well, it's a non cancerous growth. It has practically no risk of turning into cancer. Most people have no symptoms, which is why usually it's found by chance. And unlike some other liver lesions, we have not found a clear link between FNH and taking oral contraceptives. So, who tends to get FNH? As you can see in this chart, it is much more common in women. We are talking about a ratio of roughly 6 to 8 is to 1 for every man who's diagnosed with it, and we most often find it in women between ages of 30 and 50. Now, this might be because women in this age are getting simply more scans or for other health reasons. But this is definitely the peak window where it's okay. This is probably the most important question on your mind. How can we be sure what we are seeing is FNH and not something more serious? This is where imaging technology is effective. The process of figuring this out is usually pretty straightforward. It starts with an accidentally discovery on a routine scan, but to get a definite answer, we use a more specialized scan, an MRI, with a specific kind of contrast to confirm the etiology. And that brings us to what we call the gold standard for diagnosis of FNH. It's not just a regular MRI, it's an MRI with a special dye called a hepatobiliary agent or EOVIST. We use this as a gold standard, it's pretty accurate. Studies showing sensitivity of 97% and specificity can be even up to 100% for identifying FNH. How does this work? It's actually pretty clever. Think of it this way: FNH is made of working liver cells and bile canaliculi. When we inject that special dye, the liver cells take this up, and because of that, in the delayed phase, they look bright. Other lesions, including cancer and usually adenomas, are not made of these functioning liver cells, so they don't take up the dye and they stay dark in the delayed phase. This bright versus dark difference in the delayed phase gives us a clear, confident answer, so usually we can make a confident diagnosis. So let's move on to the next question on what truly matters. What happens now? What does this mean for your health going forward? And the answer: the majority of the cases, there is no long term consequences. Once FNH is clearly identified, especially with MRI or sometimes with biopsy, that's usually the diagnosis is made. We generally don't need further scans. And if you have no symptoms and if the lesion is small, you don't need treatment either. And this is why making the diagnosis is so important. It allows us to confidently tell the difference between FNH and something else like hepatic adenoma. Adenomas are also benign, but they do carry a small risk of bleeding or transforming into cancer. So these adenomas usually require monitoring. Being able to more definitively say that it is FNH lets us avoid unnecessary follow up and worry. So, to summarize everything, let's get all the information together. The most essential point to remember about FNH: after listening to all this, if there's only one thing you want to take home, what it should be, it's this: FNH is common, non cancerous finding. Once a definitive diagnosis is made, it should bring you reassurance, not continued anxiety. For the vast majority of the people, it's a condition that will not affect your health and you don't need further surveillance. Thank you.